Hi, this is speech number 2 on current events. I'm going to show you my audience. I've got Amber, Gail, Terry, and Mary, some lovely coworkers who put up with me. Here are my 2 index cards. Okay, so many people thought that the crisis in healthcare would end on an announcement made in May of 2023 by the Biden-Harris administration on the White House website would end the COVID-19 public health emergency. But healthcare is facing another threat: staffing shortages from across the nation. Many healthcare practitioners prepare to leave the profession. An article by Jacqueline Diaz from May of 2023 for the Oregon Public Broadcasting website states that 1/3 of all healthcare practitioners would leave the field for a different career over the next 10 years. Diaz further discussed findings from a survey done on almost 300,000 healthcare workers by AMN Healthcare that indicates increased levels of stress, feeling emotionally drained, burnout, and increased workplace violence are among some of the reasons for staff shortages. Maria Leach, an author with Business Journals, reported in February of 2023 that 45% of all doctors are over the age of 55, and more than 40% of them will be over the age of 65 in the next decade. Also, the average age of nurses is 57 years old. So retirement is just going to add to the loss of our staff. Robert Preston is a director and editor of the Oracle Business Management Group, and he wrote an article in February of 2023 called Strategies to Help Mitigate Healthcare Staff Shortages. In this, he explains many options to help mitigate that. Number 1, providing telehealth options. This decreases workload in a facility. 2, give healthcare workers a voice. Let them help determine their best practices. Give them options of healthcare. Number 3, spread around the responsibilities between all staffing and agencies. And number 4, customize recruitment. Encourage younger people of different diversities to enter into careers in healthcare. Now, as a healthcare worker myself, I've been in practice for over 20 years, and I can relate to the strains of staffing shortages in the medical community. The question is, what should we be asking? What are we prepared to do to face the next big crisis in healthcare?